Hi, I'm Dr. Josef Witt-Doerring, and today I want to talk to you about the danger of a bipolar misdiagnosis. So, oftentimes in our clinical practice, we help patients who have been misdiagnosed with bipolar disorder. They may have been put on a medication like lithium, Depakote, or an antipsychotic, and they've been on it for several years, and they're having problems, they're having side effects to these medications. It might be weight gain, it may be thyroid problems or liver problems, or they're worried about tardive dyskinesia. And they're coming to us because they want a reassessment. A lot of the times we actually find that these individuals may have actually been misdiagnosed. And when we look back at their history, things don't quite add up. So I wanted to share with you kind of what I think are the two most common ways I see people getting misdiagnosed, and you could apply it to yourself and you could see if this may be something that's going on with you. So the first way I see this happening is that you'll have someone who has depression or anxiety. They'll get put on an antidepressant medication. They'll be on it for several months. Then they will have a dose increase. During that time or shortly thereafter, they become essentially manic. They may become highly irritable. They may have emotional mood swings. They may even get to the point where they're making suicidal threats. Their families are very worried. They bring them into the emergency room. They get admitted to the psychiatric hospital, and the antidepressant gets stopped, and the consultant psychiatrist up there goes, well, you do have this prior history of depression, and now you're showing something that might be mania. They end up just putting the patient on, it might be Depakote, or it may be a medication like Seroquel or another antipsychotic medication. They usually stabilize because the antidepressant has been withdrawn, and then they're out to community care. And this patient often ends up just staying on this medication. There doesn't appear to be this reassessment where, their outpatient psychiatrist, maybe takes the time that they ought to have to say, well, let me learn a little bit more about the clinical history leading up to this manic episode. It just kind of gets continued. And it goes on, and the person believes, I have a bipolar disorder, I just need to take this medication perpetually. That's one way it happens. The other way it can sometimes just happen without an antidepressant, and that is you have someone who has a history of trauma, and usually at baseline, these individuals have this kind of heightened nervousness in their in their body. It's the trauma reaction. They're fearful. They sometimes have mood swings, and this is just a way of being. Maybe this person has some life circumstances that make things especially bad, and they become highly depressed and irritable, and they end up in an emergency room in a psychiatric hospital. The psychiatrist interviews them, and they ask them about their history and their trauma history, and they complain about mood swings. They go, I feel like one day I'm fine, the next day I'm terrible, and usually this is complemented by the history of the family. And the individual may say, well, sure, this could be PTSD, but maybe this is kind of like a bipolar 2, a more irritable bipolar 2 type situation. And then the same thing happens. They may say, well, I might as well go ahead and treat this because this is causing significant distress. That individual, again, goes into the outpatient world, and if they don't have a fairly psychiatrist that's looking at things closely, they may just take that for granted and continue the medication. And so those are the two ways I see a lot of people get put on bipolar medications when they don't actually have it. So what are the consequences? Well, the long-term use of medications like Depakote can definitely lead to weight gain and liver problems. With lithium, it's even worse. You can have kidney problems, you can have thyroid problems. With the antipsychotics, it causes permanent movement disorders in some people, and also weight gain. So if you have to take one of these medications long-term, and a lot of people do, you really need to make sure you got the diagnosis right. Otherwise, you're setting yourself up for a lot of problems. Oh, and one more thing. Something that often reinforces the diagnosis is you may have been one of these people I described in my story. All of a sudden, you stop the medication, or maybe you don't taper down from it gradually, or even you do in a fairly gradual way. You have this withdrawal reaction which manifests as the opposite of the drug effect, which is usually a calming one. And the people become highly irritable and emotional, and sometimes even suicidal, sometimes even psychotic during these withdrawal reactions. They're back in the hospital, and the whole history seems to reinforce the fact that, oh, I need this medication, this patient needs this med, otherwise it's dangerous, when really it's just been a withdrawal reaction. So I hope you found this video helpful about how we see bipolar misdiagnosis. If you think that something like this is happening to you, I'd recommend you go and consult with a psychiatrist you trust and get a more thorough evaluation. Don't go stopping any medications without medical advice and someone who really knows what they're doing. So thanks so much, and I hope you enjoyed this.